Okay, I think we've got quite a nice start to the intersection of business and healthcare, and thank you very, very much, Brad. With that, let's start our first two tracks today, innovation and entrepreneurship. We'll go first, and Fred Ledley is here as a track chair, and Linda Edelman. And I'd ask if the speakers would please come up. And I think we have some name tags set up for you. Thank you.
So that was great. Thank you very much for coming to Bentley and giving us a lot to think about. So this first panel is focused on innovation and entrepreneurship, two very popular topics, both in business schools, but also in healthcare these days, as you just heard. And we have a variety of topics. We have very short time, so I'm going to say nothing else except to introduce the first speaker. The first speaker is Naomi Achrafieh from the Department of Management. And we will pass the trigger down to you. And I will tink this glass at 3 minutes, okay, which means time to wrap up.
Hello everyone, my name is Naomi, and today I'm going to be talking about signals of quality in angel investment.
Naomi, a little louder.
Okay. So one of the most important events for entrepreneurs is to obtain external financing. Angel investing is an early stage financing process. It's where private individuals provide capital for startup companies, and although lots and lots of firms apply, very few firms get funding. So we use signaling theory in this paper to help us understand the ways that new ventures communicate their credibility to investors. Signals are basically signs that firms use to indicate upfront to investors that this is an investment that is worth making. This can be an example of having a current customer base or intellectual property or being referred to by another investment group. And for signals to be effective, they need to be easily observable, reliable, and costly to imitate. So our research looks at two questions. First, we look at if medical firms are more likely to make it through the angel investment process. And we also look at if the signals that firms use in the medical sector are different from the signals that are used in other types of industries. We collected data for 732 firms seeking funding between 2007 and 2010, and we tracked their progress through 4 stages of angel financing. So we started out with hundreds and hundreds of firms applying every year, and by the time that we get to the last stage, which is due diligence, we have only 40 firms that investors are looking at seriously. So the vast majority don't make it through the process. We use a chi-squared analysis to see if the signals that medical firms send are relatively different from signals in other industries, such as consumer goods or technology. We found that our angel investment group generally favor investing in the medical sector, and we also found that the largest barrier for medical companies is the second stage, which is the small committee screening. That's when most of them get filtered out. We think that one of the reasons for the different outcomes may be the types of signals that the medical firms send. So medical sector companies are significantly more likely to have intellectual property, and they're less likely to have a customer base, which makes sense given that these firms are typically medical device firms that are seeking funding through clinical trials. Finally, this has implications for both researchers and entrepreneurs. For researchers, we find that context matters, or industry in this case. And for entrepreneurs, we find that developing an understanding of the signals that they send is vital. Thank you.
Thank you very much, and right on schedule. I didn't have to use my glass here. Our second speaker is Jennifer Barline from the Center for Integration of Science Industry in the Department of Natural and Applied Sciences.
Thank you. Good afternoon. Today, my talk is going to discuss research that I've done tracking cardiovascular disease drug development. So over the past 15 years, one of the major successes has been the dramatic reduction in deaths due to cardiovascular disease, but it still remains the #1 killer in the US. And as you can see from this graph here, entry of new drugs into the market has been slowing since 2000, causing for concern. So to study this, we gathered data for 168 approved drugs for cardiovascular disease, and we collaborated with Tufts Center for the Study of Drug Development to gather information on clinical timelines. We applied our quantitative model to assess when research on the underlying biology associated with the drug was initiated, and when that research was mature or the biology was established. So we used this model to analyze the approval of new drugs by the FDA in relation to the length of basic research required for those drugs. An important distinction that I'd like to note is the method of discovery for these drugs. Some of the earliest drugs were developed from phenotypic observations of molecules with known biological activity, such as those in natural products. For example, there were observations back in 1500 BC that willow bark had pain-relieving, fever-reducing, anti-inflammatory effects. And then in the mid-1800s, aspirin was extracted from willow bark and is now a very common drug. But the development of more recent drugs encompasses the modern era of advances in biotechnology and involve lengthy research to identify and treat specific biological factors involved in the disease. So these advances had led to development of innovative strategies, particularly in the area of cholesterol-lowering drugs like statins. While phenotypic drugs dominated pre-1980s, after 1980s, most of the drugs entering the market have been targeted. So our research also found that the approval of targeted drugs rarely comes before the underlying biology is established. So notice that the time from initiation of research to approval is much shorter for phenotypic drugs than they are for targeted drugs. So this graph shows the various development pathways that we observed for cardiovascular drug development. A lot of time has been spent trying to shorten clinical time, but this would have a smaller impact than compared to strategies that try to shorten the time of basic research. This study has several implications. The lack of emergence of new cardiovascular drugs may reflect the transition from phenotypic discovery to targeted discovery that occurred in the 1980s. And this work also suggests ways that to promote innovation in drug development, quantitative models that forecast biotechnology growth may be useful for strategic management, translational science, engaging expectations of clinical trials, and that can help improve overall efficiency. And I invite you to come see more details at my poster, and I'm excited to answer any questions you may have. Thank you.
Thank you very much. Again, we're right on target. Okay, our third speaker today is Liz Brown from the Department of Law, Taxation, and Financial Planning.
Good afternoon, everybody. I'm going to talk about the dark side of the quantified self movement that Dr. Hesse was talking about in his presentation at lunch. My paper is on workplace wellness programs. These are the programs that allow employers to provide incentives to employees so that we will all volunteer a lot of information about our health to our employers. And this could include how much we've exercised or what we've eaten or how much we've slept. I have a colleague at the University of Pennsylvania a university in Pennsylvania, who the entire faculty and staff were subject to a weigh-in. So thank you, Sandy, for not making us do that here. These workplace wellness programs are really popular because a lot of employers think that they will help reduce health insurance costs in the long term, and those costs are, of course, skyrocketing. Employees like these programs because we get gift cards and other goodies. So the federal law about workplace wellness programs allows employers to use incentives of up to 30% of an employee's health insurance costs as an incentive or as a penalty. And that could be a lot of money. In the Boston area, that could be as much as $3,000 a person. And so an employer can use an incentive of up to $3,000 either as a bonus or as a penalty for non-complying and still be running what's considered a voluntary employment program. So that's great, right? It's not necessarily great because the information collected through these programs can be used against the employee in perfectly legal ways. For example, people who eat more and sleep less than their colleagues could be fired at will, but it's not illegal discrimination because they're not being fired for a disability under the Americans with Disabilities Act, necessarily. Also, if their health-related data is not always secure under HIPAA, we think of HIPAA as the health privacy law, but it's not always secure because of the way most employer wellness programs are set up, and even if HIPAA covered the transfer of this data, it's not possible for the employee to sue the employer directly under HIPAA because of how that law is structured. So given these discrimination risks and given these privacy risks, what's the benefit? And my answer is not that much, because these programs aren't necessarily improving long-term employee health or reducing insurance costs. And the lowest income workers are the ones who are least able to afford that potentially $3,000 cost of protecting their health privacy. So they are at the greatest risk of these discrimination and privacy risks that really we all face from the insufficiently regulated and protected transfer of health data under employment wellness programs. So I'd be happy to discuss this more with anybody who's interested after the conference.
That was immediately relevant to the talk we heard about the ubiquity of health data. That was great. Okay, our fourth speaker on a very different topic is Tony Kachevsky from the Department of Natural and Applied Sciences.
Okay, there's been a confluence of events recently that have promoted interest in genetic manipulation of mosquito vectors. One of them you might have heard of, it begins with Z, it's a four-letter word. And the other is a revolution in gene editing technologies that have really created lots of possibilities for messing around with the genomes of mosquitoes. There's one that's actually a product now. There's a biotech company called Oxitec that has patented a mosquito whose the progeny of whose crosses, basically all the female progeny perish, basically. So it's kind of a biased approach. Not sustainable, but probably a good business model because it kind of runs out and you have to keep releasing mosquitoes every year or so. But there's interest in other more sustainable approaches, and there's lots of possibilities out there. So what I did, I basically developed a simulation platform based on one of the few simulation tools that I use. I'm a one-trick pony. It's called Automata, Cellular Automata. And I plan to use this, one, in my classes, and also just to explore some of these new gene manipulation methods as they pop up. And to start off, what my poster is about is a particular one called homing endonucleases, which actually can target very specific genes and splice themselves into the middle and disrupt them. And so they're proposing to use this to actually create crosses that are completely lethal. So the carriers would not necessarily die, but all the homozygous progeny would. It's not just the females in this case. And so that's what my poster is about, and I explore some of the parameters that are important. One very important one being the fitness of the carriers. That seems to be a very critical parameter in determining whether you can actually dominate a mosquito population or not. And so the results are in my poster, and I invite you to come see it afterwards. Thanks.
Can you push the slides up to the next, who is the trigger?
Pass it down.
Oh, I didn't even know we had that.
Okay. Our next speaker is Helen Meldrum, also from the Department of Natural and Applied Sciences.
Thanks. And I can go right off the bug topic from you, Tony, because in terms of the numbers that I was looking at, and the people are familiar with, of course, is the price of drugs is bugging everybody, right? And so they don't track other numbers, and the other numbers are very unchanged in this business, which is, even with recent research, it's still about 1 out of every 10 agents makes it past the FDA, past investigational, past the phases to make it onto the market, which is pretty discouraging, and it's still a journey of sometimes 10 to 15 years. So I was interested, amongst other things, is how do tippy-top executives take on team members that are willing to do this marathon-like process to be able to make it all the way through. To get my population, I used the BioCentury 100, which is the top market capped companies in the United States. From there, of the CEOs, CSOs, and CMOs, I had about 250 people to try to target. I was able to speak to 46 of them and finally get sign-offs from 44 CEOs, CSOs, and CMOs. And what was really interesting to me is the types of things they started to tell me on this topic, which is that they are interested in finding people who have a different level of emotional commitment to making it through to all the way to the FDA, to people who have kind of an eyes on the prize mentality on the part of the patient, that people who are somewhat diverse in their personalities so that they're better at problem solving, and they go well beyond kind of a resume type review. So here's just a little flavor of some of the quotes, and I call these committed and creative. To be in biotech and survive the failures, you have to be aligned with a purpose that's greater than your salary and title. They have to come into work every day jazzed and realize they're doing something meaningful and it's not just a job. It's harder to stay motivated, I think. Finding people who've been around the block and can handle the setbacks in a way that helps them apply learning and move on to the next program, which of course, because so many are canceled because of failure. Find great talented people that have seen companies being built but have done great experiments at a company which might have failed, but of course that great experiment, there was a lot of learning. They also know they have to push people to see what their real performance was all about. One CEO said they all want to tell me the exhilarating story about that one time they got through the FDA, but she'd much rather hear about their failures and how they come back from their failures, since that is much more typical. And again, George Gangos, our local CEO from Biogen, says he asks people to talk about their reasons for failure and to make sure that they don't talk about all the other people who failed them, since that would be sort of a tip-off that they're not the type of folks that he wants around. They did mention diversity as a deterrent to groupthink, and they don't want to hire somebody in their own image, which I thought was pretty smart. And the reason they want that, and I thought this was a good quote to bring that home, is you need the balance of personalities, because any one individual is likely to give up too soon on the right thing or continue slogging away on the wrong thing. And I thought that was a great tribute to sort of that kind of mental diversity. So just my initial commentary is that they are searching out peers at a senior level that have a very deeply ingrained vision. They know that the easy targets have already been discovered or are already on the market. They're in a tough business. They want people who can articulate how they've handled those failures in the past, and they want people who can really do the problem solving. You'll see this more in my poster, but I do feel very gratified that I got about 20% of the total population I went after, and that was a whole extra paper in telling you about how to be resilient in terms of getting through to these top C-suite people. That will be a whole separate discussion. I do want to just say to Brad, and I've said this to Danielle, I found that a lot of these people are in the oncology space, and I called them my optimistic subgroup, and they would often say, remember how we didn't think we'd make progress with HIV? And they said in 10 years we had an impact, in 20 years we had some refinement. They say that's what's coming with oncology right now. So thank you.
I think we could have studied success and failure and how it affects your psyche by talking to Helen every day over the last year. Days of great success and days of not so much.
No.
So our next speaker is Robert Schultz, who is working with the Center for Integration of Science and Industry. He's also an adjunct professor in the Department of Marketing.
Thank you. So I feel extremely lucky to have had the opportunity to interview the primary stakeholders in what has become the world's most successful drug. And I really have a Bentley alum, Bob Anderson, to thank. As the story goes, back in the late 80s, he was a accounting and operations manager with something completely unrelated, magnetic tape. And as that industry was dying, somebody tapped him on the shoulder and essentially asked him, hey, would you be interested in leading a new biotech initiative in Cambridge? And so he really, this is actually scrolling. I don't know how to fix that.
It goes forward and back?
Yeah, but it's been going on its own. That's all right.
Okay, all right.
So really the story here is a collusion between science, industry, and policy. And Bob was able to open the door for interviews with all of these stakeholders, people like Bob Kamen, who was the president of BASF through its inception, and then when they built their bio research park in Worcester, through the Abbott acquisition and AbbVie as well. So as the story goes, back in the late 80s, genetic engineering was actually banned in Germany. And if they expected to commercialize their new asset, which they called D2E7, it later became known as Humira, they would need to develop it outside of Germany. And they had the wisdom maybe to talk to Massachusetts, and fortunately we had great leadership, and we still, I believe, do. Governor Michael Dukakis was able to work with civic leaders from the city of Worcester in order to encourage this behemoth, giant German chemical company to build their pharmaceutical division in Worcester, Massachusetts. So it was really because of this collusion between science, industry, and policy that we were, able to actually help, many people who suffer with autoimmune diseases like Crohn's and colitis, arthritis, psoriatic arthritis, and other forms. And really, in the end, I was very fortunate that we were able to have an event at the end that culminated where these folks came to our campus. The president of Bentley actually spoke, which was incredible. And then we even had the president of the Massachusetts Biotechnology Council, Bob Coughlin, provide some remarks as well. So I'm very happy to say that it could be any one of us in this room who goes on to be the next big selling drug. Thank you.
Sorry about the slides moving. That was my fault. We used the slides last
I handled it.
as the introduction for the event we held a couple weeks ago. There's an amazing video online if anyone wants to watch these contributions of people who created a drug that now sells $14 billion a year, one of whom is a Bentley alum. Very interesting. Okay, our next talk is by Chenggang Shang from the Department of Finance.
Thanks, Fred. I'm Chen Guang from the Finance Department. So today I'm going to be talking about political connections and corporate innovation. So politics and finance have become a very interesting and popular topic in the last few years. And actually with the presidential election coming up just next week, I find our study very relevant and timely. So my co-authors and I, what we do in this study is that we investigate this potential impact political connections may have on corporate innovation. So the main finding is that connected firms are associated with higher innovation productivity. So what do we mean by political connection? So we use three different proxies for political connection. The first one is we look at whether a firm has a former politician on the board. And the second one is whether the firm spends money on lobbying, trying to influence policies. And the third one is whether the company contributes to political campaigns. As far as innovation goes, we look at the patents filed by companies, which is a measure of innovation output. We also look at the citations received by these patents, which is a measure of innovation quality. So the main finding is that politically connected firms tend to be more innovative. Now, we also examine different scenarios, different situations where political connections may be more valuable. So we find that the effect of political connection is more pronounced for firms from the high-tech sector, for firms facing greater financial constraint, and also for firms operating in more competitive industries. Last but not the least, we try to we try to explore a potential channel through which political connections may influence innovation output. So we find that politically connected firms are more likely to receive federal grants and also larger amounts of federal grants. And these grant awards, in turn, help these connected firms improve their innovation output. So that is the big picture of our study.
Okay, our final speaker in this section, and also the first speaker in the next section, is Chris Skipwith, who is in the Department of Natural and Applied Sciences.
All right, thanks, Fred. So I'm going to continue along this theme of connected health, and I think it's fitting that I'm actually the last speaker in this section because I'm going to describe how we go forward with the innovation that's done in the medical research community. So as diagnostic devices become more portable and less attached to a clinical laboratory, it becomes more important to understand how to interpret results. And furthermore, as devices progress from static measurements in time to continuous measurements, improvement to data analysis methods becomes critical. My research focus is on the interpretation of continuous clinical data and how it can be used by healthcare providers to diagnose and treat disease. In the medical device technology development pipeline, acceptance criteria are routinely assigned to device candidates to indicate their potential clinical utility. After the mechanisms for the recognition and reporting of targets of interest are identified and tested, a newly developed diagnostic undergoes a process called validation. Here, reliability, reproducibility, and sensitivity of the device are assured. The typical steps in a device validation cycle are shown on the left side of the screen. My research has primarily dealt with the third and fourth points, which are fitting data and scoring data after getting a validation device. However, we have become increasingly concerned with the last step indicated in red, which is involving comparison to a known clinical standard. So based on the agreement between the standard and the new diagnostic, acceptance criteria are generally generated for all iterations of the device, and final candidates are selected based on these highly restrictive criteria. While medical research has provided key information about novel molecular targets and their relationship to disease, many of these molecular targets do not have established clinical standards. Therefore, we must use research laboratory methods to provide comparison standards. Often, these methods cannot sufficiently detect the total amount of targets in clinical samples. And so my research is using computational and numerical methods to establish a protocol for extending the dynamic ranges of diagnostic targets, measured by a very common clinical lab technique called mass spectrometry. We assessed 20 clinically relevant targets and determined that we could extend all detection ranges into the acceptable clinical standard range. So this innovation improves the validation process for diagnostics that detect new and novel targets. Thanks.
Okay, so I want to thank everyone. What a wonderful job. I think we should give them one more round of applause. What do you say?
I think we might have time for a question or two if anybody in the audience would like one. Okay. Now we'll give them another round of applause.